Welcome back to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Now, let me ask you a question that might make you a little uncomfortable. When you think about managing your diabetes, what's the first thing that comes to mind? Is it checking your blood sugar? Watching your carbs? Maybe your doctor mentioned your A1C? While all of that is crucial, there's a silent, often overlooked threat that every person with diabetes needs to understand. I'm talking about heart disease. The connection between diabetes and heart disease is not just a minor link. It's a fundamental biological chain that binds them together. But here's the empowering part. This chain can be broken. Today, we are not just going to talk about the problem. We are going to equip you with 5 powerful, actionable strategies to protect your heart, starting right now. Remember, this information is for educational purposes and is not a substitute for professional medical advice. So let's dive in. Segment 1, the silent connection. To fight an enemy, you first have to understand it. So let's break down exactly what's happening inside your body. When your blood sugar is consistently high, it's like circulating tiny shards of glass through your delicate arteries and veins. This is called endothelial dysfunction. It means the smooth, protective lining of your blood vessels gets damaged. Your body tries to patch up this damage. It uses cholesterol, specifically the bad LDL cholesterol, as a kind of plaster. But when the damage is constant, this plaster builds up and hardens, forming what we know as plaque. This process is atherosclerosis, or the hardening of the arteries. Now, imagine this happening throughout your entire circulatory system. In the arteries leading to your heart, it's called coronary artery disease, which can lead to a heart attack. In the arteries leading to your brain, it can cause a stroke. And in the tiny arteries of your kidneys and eyes, it leads to the other common diabetic complications. High blood pressure often joins the party because your heart has to work much harder to pump blood through these narrowed, stiff pipes. So, you see, it's not just about a single number on your glucose meter, it's about a systemic assault on your entire cardiovascular system. Segment 2, 5 ways to protect your heart. Understanding this process is the first step towards stopping it in its tracks. The goal isn't just to lower blood sugar, it's to protect your blood vessels. And that's exactly what our 5 strategies are designed to do. Let's get to them. Strategy 1, master the plate, the anti-inflammatory eating method. The first and most powerful tool you have is on the end of your fork. We're moving beyond just counting carbs and into the realm of anti-inflammatory eating. Think of every meal as an opportunity to soothe your blood vessels, not inflame them. Instead of highly processed foods, white bread, and sugary snacks, which spike your blood sugar and promote inflammation, we want to build our plates around whole, fiber-rich foods. Fill half your plate with non-starchy vegetables like leafy greens, broccoli, and bell peppers. Their fiber acts as a buffer, slowing down sugar absorption and feeding your healthy gut bacteria. For a quarter of your plate, choose a lean protein like grilled chicken, fish, or tofu. And pay special attention to fatty fish like salmon, mackerel, and sardines. These are packed with omega-3 fatty acids, which are like a healing balm for your arteries, actively reducing inflammation and helping to lower triglycerides. For the final quarter, opt for a high-fiber, complex carbohydrate like quinoa, lentils, or sweet potato. And don't fear healthy fats from sources like avocados, nuts, and olive oil. They are crucial for heart health. This isn't a restrictive diet. It's a strategic way of eating to fortify your body from the inside out. Shifting to anti-inflammatory eating can feel challenging. And if you ever struggle with cravings or knowing when you're truly full, our free Blood Sugar Squad Mindful Eating Guide is for you. This practical workbook teaches you to understand your body's true hunger signals and turn every meal into a tool for stable blood sugar. To download your free copy, just scan the QR code on screen right now or click the link in the description below. This is our gift to you, so download yours now. Strategy 2, move it or lose it. The glucose disposal effect. Strategy number 2 is all about getting your body moving. But this isn't just about burning calories. For us, exercise has a superpower called the glucose disposal effect. When your muscles contract, they can pull glucose directly from your bloodstream to use for fuel, and they do this without needing insulin. This is a game changer. It's like giving your overworked insulin system a direct bypass. We want to focus on 2 key types of movement. First, aerobic exercise. This is anything that gets your heart rate up, like brisk walking, swimming, or cycling. Aim for at least 30 minutes most days of the week. This directly strengthens your heart muscle and improves its efficiency. Second, and this is non-negotiable, is resistance training. Lifting weights, using resistance bands, or even doing bodyweight exercises like squats and push-ups builds lean muscle mass. And muscle is metabolically active tissue. It's a glucose-burning furnace. The more muscle you have, the more places your body has to store excess sugar, which means lower, more stable blood sugar levels around the clock. You don't need a gym. Start with 2 days a week, and remember, consistency trumps intensity every single time. Strategy 3. Know your numbers beyond blood sugar. This third strategy is about becoming the CEO of your own health. To protect your heart, you need to expand your focus beyond just your blood sugar. You need to manage a trio of critical numbers, your personal health dashboard. First, your blood pressure. Aim for a target below 130/85 mEhg. High blood pressure forces your heart to work under immense pressure, straining it and damaging those already vulnerable blood vessels. Second, you must understand your full cholesterol panel. It's not just about low cholesterol. You want to drive down your LDL, the lousy cholesterol that contributes to plaque. You want to raise your HDL, the hero cholesterol that helps clean up and remove plaque. And you want to lower your triglycerides, a type of fat in the blood that is highly influenced by sugar and carbohydrate intake. And of course, we still track our A1C, the 3-month average of our blood sugar. The American Diabetes Association generally recommends an A1C of less than 7% for most adults, but you must work with your doctor to set a personal, safe target for you. When you manage these numbers in concert, you are building a fortress around your heart. Strategy 4. Medication adherence and heart protective pills. It is absolutely critical to take your medications exactly as prescribed. Do not skip doses because you feel fine. These medications are often working silently in the background, providing a protective baseline that lifestyle efforts build upon. Furthermore, have a conversation with your doctor about a relatively new class of diabetes medications that have shown remarkable heart protective benefits. Drugs known as SGLT2 inhibitors and GLP-1 receptor agonists were originally designed to lower blood sugar, but large-scale studies found they significantly reduce the risk of heart attack, stroke, and heart failure. They can also aid in weight loss and lower blood pressure. Asking your doctor, "Are one of these heart protective medications right for me?" could be one of the most important conversations you ever have. Strategy 5. Reduce stress and heal the heart. Our final strategy might be the most underestimated of all: mastering your stress. When you are under chronic stress, your body is flooded with hormones like cortisol and adrenaline. These are your fight or flight chemicals, and they have a direct and negative impact on your body. Cortisol tells your liver to dump stored glucose into your bloodstream for quick energy, causing unexplained spikes. It increases your blood pressure and heart rate. It promotes the storage of dangerous visceral fat around your abdomen, which is highly inflammatory. In short, chronic stress directly fuels the very processes we are trying to stop. So, you must create a daily practice to discharge this stress. This isn't optional. It could be 10 minutes of mindful meditation, focusing on your breath. It could be a daily walk in nature without your phone. It could be a hobby you lose yourself in, like gardening or painting. It could be connecting with a loved one or even seeking therapy. By actively managing your stress, you are turning off the toxic hormonal faucet that is damaging your heart, one calm breath at a time. Segment 3, Final Thoughts. So, there you have it. Your 5-point plan to break the chain between diabetes and heart disease. We master our plates with anti-inflammatory foods. We move our bodies to create insulin-independent glucose disposal. We become experts on our key health numbers. We use medication intelligently and adhere to it faithfully. And we make stress management a non-negotiable part of our daily routine. This isn't about achieving perfection. It's about consistent, mindful action. Every healthy meal, every walk, every moment of calm, every pill taken, it's all a brick in the fortress you are building to protect your most vital organ. You are not a passive victim of your diagnosis. You are an active participant in your health. Thanks for watching. What are your thoughts about diabetes and heart health? Comment below and share this video with someone who needs it. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.